Somebody asked me at the gym how I worked out was me having this injury, and I said heavily modified. Every single thing is modified. I returned to the gym and I remained non-weight bearing because I was to remain non-weight bearing as much as possible. In fact, remain non-weight bearing full stop for at least a month post-op. Returning to the gym just meant getting movement in, most of which was upper body, and I did have a backpack that allowed me to keep my foot elevated and out of the way when I did some of the exercises. Of course, I avoided some of the obvious ones that would require more balance and use of my feet. So I avoided those and stuck to mostly an upper body routine for that time. I also didn't return to the gym full scale, meaning I didn't go 5 days a week. In fact, I started just going back 2 days for the week. It was 1 and then 2 days for the week. And then I'm now up to 3 days for the week. And that's just how it made sense for me, because the first week back in the gym was just about getting back into the gym, into the habit of doing it. The next week was really about getting into the routine of my workout. I have a program that I follow, and it was just getting back into the routine of doing those movements and modifying them in the way that made sense for the injury that I have. And then the third week was kind of just finding that groove and kind of rebuilding some of my movement patterns, and you don't really lose them, but for me it was just getting readjusted to doing the movements that I would typically do, just very heavily modified. Somebody asked me at the gym how did what has changed with me being on crutches or with me and this injury, and I told them honestly. They asked me how I worked out with me being on crutches or just me having this injury, and I said heavily modified. Every single thing is modified with the exception of the movements that don't require me to use my feet. Even then, they're modified in terms of I'm using less weight. I mean, my range of motion might not be as deep with certain exercises, or might be limited because of the injury that I have, but it has been heavily modified and I'm 100% okay with that. The point of me going back was to get back into the habit. It's a habit that I formed over the years, and the longer I stayed out, the harder it is to get back in. So that was the point of me getting back into the gym.